Thanks, Minister, and good morning. So today is a significant day for all Victorians, not a wholesale change, but an appropriate next step in this phase of the management of the pandemic. So from Saturday, it will absolutely focus more on the individual discretion of all of us in the community to make appropriate choices for ourselves, to protect ourselves and protect those around us as we go about our day-to-day lives. The phase that we're in now is only possible because of the very high vaccination coverage that we've achieved. Really astonishing protection for our population and the many millions who've been vaccinated right through this pandemic, but in particular the third doses that have been given through the course of this year at GPs, pharmacists and state-run centres and all our community pop-ups. Just fantastic work to give us that protection that allows us to be here making these changes today. So I do want to thank every Victorian, every health worker, every person in our entire health system and everyone who's stepped forward to get a test or a vaccine. That collective effort has safeguarded our community and saved literally thousands of Victorian lives. We're now at a point where 19 out of 20 essentially on 95% being double vaccinated. We've got 2/3 who are triple vaccinated. Indeed, amongst those who are eligible, because some have recently had COVID, it's above 70%. And we've reached that milestone in just 5 months. And the vaccine rates among older Victorians are even higher. Got 90% coverage for those over 70, 85% for those over 65, 82% for those over 60. Really terrific figures. And it means we're in the best position to make a further easing of restrictions. It is significant, but it's a sensible one. It will allow us to get back to a better normal, help keep us safe at home, at school and at work, while we can still respond to the emerging risks. For the remaining restrictions, we're focusing on areas of highest risk, including to protect those who are most at risk in aged care, the disability care settings and in other sensitive settings where mask wearing will continue to be required. The third dose vaccine mandates for our critical workers still remains in place, so healthcare, disability and residential aged care, police and emergency services, food distribution and in education. As a community, we also need to remember those basic and simple behaviours that are part of our everyday life and that will continue to work for this variant, for any future variant. Opening windows, good ventilation in our workplaces, homes and other settings will continue to be a protection. Wearing a mask indoors continues to be a protection, and staying up to date with your vaccine. Many countries have lived with restrictions for a long period of time. Some are still imposing significant restrictions. We had our restrictions to get to a point where we knew that we would be very substantially vaccinated as our really significant protection as a community. We're at that point here in Victoria with these vaccination levels. We've got enough inbuilt protection as a community that further restrictions are really not proportionate or necessary. Of course, there's more to do. We've still got 30% of people who, if they're not immediately due for their third dose, will be very soon or are recovering from COVID and should think about getting that third dose. For those who haven't had their third dose and are due, really now is the time to do it. There are 4 reasons to do so. Our cooler months are coming. We're going to have challenges in the healthcare system through winter, as we do every winter. The flu season will be one, but there are other direct effects of colds that mean people present with cardiovascular and respiratory conditions. And there'll be lots of other respiratory conditions circulating. So a good time to be protected from COVID. Your second dose protection is good protection against severe illness and hospitalisation, but it does wane over time. So if it's been a few months, now is that time to get the third dose to reboost your immune system for protection against COVID-19. Thirdly, there are still a lot of people with significant vulnerability to severe illness with COVID, those over 50, those with pre-existing conditions, those with weaker immune systems. If you're in those categories, you really should think about that third dose now. And lastly, while cases are plateauing now and we're very likely past the peak, we do still have broad community transmission, 10,000 cases per day. So it isn't behind us. We still need that additional protection as much as possible. So don't just rely on 2 doses through winter. Make April or May the time to get your third dose. And as you know, there's a 4th dose recommendation for over 65s and some other at-risk groups that ATAGI has recommended. My mum's one of those. So as an 81-year-old, she got her COVID vaccine and her flu vaccine yesterday in the one appointment. So good on you, Mum. Please think about that if you're in those categories and get that dual protection through winter. Thanks very much.
You saw them dip down 8,000, they're back up to 10, numbers go up and down. Where do we plateau and when do you think that will happen?
I think the plateau's here. I think it's probably already behind us. We have seen a 10% reduction last week on the previous week. I think today's a blip. I think people defer some of their RAT tests and their PCR tests while they're on holiday. New South Wales has had the same blip today, but I think that'll smooth out over the next few days. And I think we'll see, this plateau phase, but it'll be a long tail and a slow decline. We're not going to see a dramatic drop in numbers. Again, just a reminder that if you haven't had your third dose or your 4th dose if you're due and eligible, you really should get it now as well as your flu dose. There's not a lot of influenza circulating right now, but it's not far away.
Can I just just clarify some mask rules? So for hospitality, is that customers and staff?
Not required.
And for public transport, do they include Ubers, ride sharing services?
It does. It does.
Why masks required at airports, but not places like Chadstone, where you've also got lots of people going lots of different places and getting together?
I mean, the requirement for airlines was a national decision, and AHPPC gave advice to National Cabinet on that, and so that's a nationwide requirement. When you're in the air, there's pretty good circulation through the ventilation on planes, but when you're actually on the tarmac, those CO2 levels go very high, above 2,000, which is a lot of rebreathing other people's air. 10 or more percent. That's a genuine risk, and if mandates are dropped on planes, I'm going to be wearing a mask when we're idling on the tarmac. So I think that's a good idea.
Just with the point, I guess, about public transport, it's still mandatory. Are you happy with the amount of people actually wearing masks on public transport because it's not particularly high?
Look, I guess not. I'm not. I'd like to see more people wearing masks on public transport. It's not fantastically high. It is a place where ventilation is a bit trickier. Buses and trains in particular. If you can open a window. That's more an option on trams, I guess. But you're in a crowded space and there's a lot of rebreathing other people's air, and so it is a good idea to wear a mask on public transport in particular.
Have you been doing any confirmed stats on the rate of people actually using them on public transport?
Look, we get regular survey data. There is, it's self-reported data. People are probably more willing to answer those surveys if they're doing the right thing rather than the wrong thing, and it's reasonably high. But you'll see circumstances, as Richard no doubt has, where there's a particular setting where mask wearing is not great. We tend to follow what we see around us, so you can be a model for other people in wearing your mask as well. But I think it's reasonable, but it's not over yet, that's for sure, and so mask wearing remains a really important intervention. I continue to wear mine in places that are particularly at risk, absolutely where it's mandated, but also in lots of other indoor settings where we're gathering. But we can make choices about that now.
Just on the decision to scrap isolation for close contacts, is it the case that now that we have these vaccination levels, less people are contracting the virus? Do you know how many in families? Is it like 1 in 10 chance, or do we know those figures when it comes to close contacts?
Look, it's still substantial for household close contacts. So it's not scrapping of quarantine per se. I think we need to talk about it as alternative close contact management, because it is. These individuals are still required to wear a mask. They're still required to work from home if they can. They need to avoid sensitive settings. We recommend that they don't have close contact with at-risk individuals, and they need to do rat tests almost every day. So they're all other mitigations that help to manage that risk. But they are at significant risk of developing illness over that 7-day period, and that's why all of those measures, including the rat tests on consecutive days, will give a much higher chance of picking you up if you're developing illness. You may well test negative, test positive, but when you're testing positive on a rat test, that's when you're most likely to be infectious. And so it's a imperfect but a pretty good way to manage those contacts alternatively.
If there
Have
is
we
still
done
a
any
significant...
modelling into how this will affect case numbers, the change in the close contact?
We have. Modelling is modelling, so we don't hang our hats on it in absolute terms, but it looks to be reasonably equivalent. So it's not going to be a big driver of case numbers to go up. It's going to be able to manage those individuals, but we need the compliance of people to follow suit, and we need all of those conditions of alternative contact management to be in place.
Where is the most significant point of transmission for you at the moment then with the statistics you're looking at?
I mean, really, it's all of those marginal things where people have minimal symptoms they need to test. So, you know, it's not just in the cases that we identify in their close contacts, it's the people who have no symptoms or very minimal symptoms who are going to transmit to others. That's why mask wearing remains a really important measure for people to think about in indoor spaces, because you won't see a symptomatic individual, but there'll be one or two potentially infectious individuals in a shared indoor space. So getting tested, wearing a mask, those indoor opportunities for transmission are really the key ones.
Is vaccination required for office spaces?
No, it's not. Again, there'll be specific workplaces where it does remain a 3-dose or a 2-dose mandate, but not for general office spaces that don't fall into those critical or high-risk industries.
And the mask rules apply to primary school children as well?
No, they don't.
Oh, so that's still being reviewed for term 2, or?
So that's not a mandate for primary school kids ongoing. Masks remain recommended.
Your most recently published advice to the Minister said that mandates for vaccines in some workplaces could actually go. Has the Minister gone against your advice by keeping it this time?
No, I mean, the Minister can speak to it, but I've made a recommendation of a transition out of those mandates, but they need to be worked through industry by industry. They need to do their own risk assessments, and they need to fall on their own policy settings appropriately based on those risk assessments. Some of them will no doubt lift those mandates and allow their workforces to attend work without a vaccination requirement, but some of them may well land on a policy that has an ongoing mandate, but that should be worked out industry by industry.
But for the time being, we're keeping the mandate.
Well, the Minister can speak to the transition point that we're going through. I've talked about a recommendation for them to transition out of that when feasible, but that has to be worked through.
When would that be feasible? Is there a time frame?
Too late.
You mentioned it's now up to the individual discretion of people to protect themselves, protect their families. I guess what is your advice to people that are immunocompromised, the elderly, going into this next phase of the pandemic?
I mean, we all need to make appropriate judgments depending on the setting that we're in and the people we're in contact with. Obviously, the TGA has approved and ATAGI have recommended a vaccine regimen for those who are most at risk. For immunocompromised people, many of those will fall into a category where a 4th dose is a routine recommendation for those individuals. I hope they're all accessing it, they've all received it. I think that'll be a really big part of protecting them from serious illness. But if you're meeting with someone who might fall into that category, you should also think about where you meet, how you meet, and whether you wear a mask in an indoor setting. I think that's always been the case. It should continue to be the case that we're mindful of particularly at-risk individuals. If there's an opportunity to meet outdoors, that's a really important decision to make. That'll reduce that risk of transmission 20-fold or more. So do that if you can. But otherwise, Our responsibility is about getting vaccinated for ourselves, because it's not just protection from severe illness. It's some protection from getting infected in the first place. You know, we need to talk about the limitations of vaccines as well as the strengths that they've provided for us. A lot of people say, you know, we've got 10,000 cases a day, vaccines aren't working. They are working. We've got a 0.09 case fatality rate as a percentage compared to 4% in 2020. It is extraordinary how much protection there is given the case numbers that we're seeing every day. But it is not a perfect vaccine for protecting us from getting infected in the first place. It's excellent protection from getting hospitalised. That'll apply to those most at risk as well.
And sorry, just one more. In terms of businesses and advice to business, is it up to them now to come up with a policy for close contacts coming into work? Should it only be, you know, necessary industries, or is that something that you'll be providing advice on, or is it up to them?
Look, their occupational health and safety obligations have never gone away. The Occ Health and Safety Act applies. We've looked after a lot of those Occ Health and Safety issues through the mandates that have been in place over the last couple of years, but they should remember that those obligations continue to exist for workplaces and for employers. So they need to do what is reasonable to manage the health and safety of their workforce and, to the extent feasible, the general community. So the conditions for close contacts will apply to all close contacts, but it is absolutely the case, as you say, for workplaces to think about anything else that they would do on top of that, including the communications and support to people to be able to manage alternative arrangements for working.
After a couple of years of us sort of having to change the rules and adjust to this, what's your gut on, does this stick? Is this us on the way out?
I think it's more steady as she goes now than it's ever been. But none of us should be complacent about what future challenges might arise. There's no question that the XEs and the BA4s and the BA5s, you know, continue to emerge. They will drive cases up to a degree. They are less likely to challenge our hospital system as we get more and more people vaccinated. But we shouldn't drop our guard on all of those protections. I do think we're entering a more stable period, but we shouldn't sit on our hands in this space and say there's no chance of a future significant wave. That remains a possibility.
About